Hello, everyone. My name is Nicole, and I am with the Anchorage Public Library. And today we are here with Samuel McElwee, who is a public health nurse from the Anchorage Health Department, for our second episode of What We Know, the Vaccine Information Series. Today we're going to be talking about getting the COVID vaccine. But before we jump in, let me review how this program is going to go. When you join, all participants will be muted except for the presenters in order to prevent any confusion or people talking over each other. And this week, instead of having a presentation, we will be going straight into our question and answer portion. And if you do have a question you would like to submit, please post it either in the chat on Teams or in the comments on Facebook Live. We do have someone who will be monitoring both locations who will pass your questions on to us as we go. If we do not manage to get to your question before the end of the program, we will do our best to answer in the comments on Facebook or include it in the next program in the series. And now that we have all that out of the way, I would like to open with a question which was submitted by a member of our library staff. Samuel, just to make sure, can you hear and talk?
I hope I can hear. I'm talking. Can I be heard?
You can.
All right.
All right. So first question is pretty basic. How is the vaccine being distributed in Anchorage?
Sure. So there's a short answer, and then there's a longer answer that I'm not necessarily perfectly up on. But the short answer is there are lots of committees and meetings and applications. Providers, and that could be anything from a private clinic to us here at the health department to hospitals, etc. We fill out requests for as many vaccinations as we think we can administer in a month. We submit that list to the state. They compile that list together. They send it to the feds, and then the feds give us however many they actually have. There are lots of kind of subcontracts and groups that work within that. For example, the native corporations go through Indian Health Service, and so the numbers of vaccine they get back is different than the number, like they pull from different pools in a sense. There are different contracts that are involved. So we request what we can get, and then the feds, we asked for, we'll say 10,000 doses, and the feds give us however many they feel they have at the time. Maybe it's less, it usually is. And then it filters back to us, and we dispense them out as quickly as we can. Currently, the kind of main, not barrier necessarily, but kind of the main bottleneck of this has been supply. There are a lot of providers in Anchorage. There's a lot of capacity to get doses into arms, but there's not a lot of actual vaccine that has been allocated to us. So whenever we get stuff, kind of the silver lining of it is it doesn't sit around in freezers for very long. We get it, and we're getting it out and vaccinating people almost as soon as we have it.
All right, thank you. And for Anchorage specifically, how was distribution decided, and is there an ongoing process for that?
There is an ongoing process for it. Let me see if I can find let's see. There are many, many, many pages of this, but here we go. So you want to pop over to the state of Alaska. They have their Department of Health and Social Services. There's an actual allocation committee. Within that committee, let's see if I can scroll down here and find some useful stuff. There's kind of the whole process for this. I would recommend anybody who is interested in kind of figuring out how this works, take a look through this. There are meeting minutes. They do have regular meetings that are open to the public for comments. And they kind of farm those out to us in that sense. So there isn't a specific, I guess I can't talk specifically about how it happens for just Anchorage because it's on a bigger scale than that.
Okay. So next question, who is eligible for a vaccine at this time?
Well, that is an excellent question. And I almost wonder if it would be helpful if we went through the whole kind of vaccination process step by step, starting from how do I determine if I'm eligible, all the way through what do I do after I've gotten my shot. Nicole, do you think we have time for that?
I think we can probably make our way through that.
Okay. So we'll say that I'm interested in getting a vaccine. So what you're going to want to do is go to covidvax.alaska.gov. It will hyperlink you over. It's much easier to remember covidvax.alaska.gov than it is to remember the long DHSS URL. So go there. You will find out they have it's not the prettiest website, but it is well laid out. So I love the eligibility quiz because it's nice and straightforward for me. So I click that. I'm not currently 65. I click no. I am a healthcare worker. And then they go on to very specifically define this, and they note that it's not just people who have a healthcare job, it's people who work in healthcare. So maybe I'm an ER scribe, or I work in the environmental services at the local, say, the Pioneer Home. So I'd be, yes, I do work in a healthcare setting. I have direct patient contact. I can't do my job from home. I cannot do telework. I provide a service in a healthcare setting that cannot be postponed without detrimental impact. Well, no, you can't really draw somebody's blood if you're not there in person, and it's important to be able to get those labs. So we'll say yes. Congratulations, I fit under the 1A Tier 3, which is a healthcare worker. Suppose I am over the age of 65. I am currently eligible by default, no matter what my job is or who I am. A question that comes up a lot of the times as I've been doing vaccinations for a while is, I'm high risk. Maybe I have diabetes and I did some cancer treatments or something, and I'm concerned that if I get COVID, it'll be a really serious illness for me. I would love to be able to get you vaccinated, but unfortunately, I think this is a common misconception, is that the increased risks do not move you up the tier lists. It's very specifically based on this kind of criteria. So if you're over the age of 65, you are currently eligible. If you work in direct healthcare, currently eligible. If you are 58 with a lot of pre-existing conditions and you're concerned, unfortunately, you're going to have to wait until the next tier. Moving on in the how do we get vaccinated strain. So I've determined that I'm eligible, we'll say. I'm going to go back. I'm going to find an appointment. So step 2, I have confirmed I'm eligible. As you can see, there are lots of ways to do this. I like the map format. So I'm going to go ahead and open up that because I'm sort of a visual learner. Hopefully you guys can all see my screen still okay. Yeah?
It's working on Facebook. I'm not seeing it, but
okay.
I did confirm it is working.
I don't get a presenter view, so I don't know if it works or not. So I'm in the Anchorage area, but as you can see, there are lots of opportunities to get vaccine in the state of Alaska. So I'm going to scroll in and let's see. What's the general Anchorage area looking like? There are a variety of locations, and I'm sure this is going to be a question that shows up. I think I've reviewed. I got some of the questions kind of sent to me as like, hey, these will be common questions. Expect to see this. And one of them is, who do I talk to get a vaccine? And it will depend on if your provider, maybe your local doctor or whatnot, has already signed up with the state of Alaska to be a vaccine distributor. But my understanding is that the process is not actually that involved. They just actually have to go in and their register and say, hey, I would like to be able to do this. So the actual process for becoming an authorized provider is quite simple. You pick a spot. We'll say I'm here at the health department, and they tell me how to make an appointment. We currently don't have the staff to support phone appointments, so we're strictly going by website, or you can send an email. For folks who don't have either a computer to use or a phone of their own, the registration process typically involves one or other of those two, because we need some way of getting a hold of you if we have to move the clinics around. It is a known issue for some of our elders in the community who don't necessarily have the most up-to-date technology or who have some difficulty navigating it. I've personally called a lot of people and registered them over the phone, so I know that's a capacity we have, but there's only me and a couple of other people, and obviously if I'm out in the community doing vaccines, I can't be in the office doing registrations. So the best piece of advice I could give to somebody who needs help getting a vaccination would either be contact kind of whoever your provider is directly, which usually there are options there, or ask a friend, a family member, daughter, grandchild, whatever, to give you a hand with that. But the actual process of registration itself shouldn't be too involved. There is plan to roll out a service for folks who need assistance with this. It's a process of asking people to register, and then we have to actually run the contracts for that, which is above my pay grade. I don't deal with contracting. But I know that there is a hotline for assistance with this that I think, opened actually just today. The state of Alaska did. So it exists. It's out there. You can get assistance with this. But it sort of necessitates you being able to actually tie into a phone line. So that part might involve you asking somebody for help. So we say here, I can click here, we go in, and it lists some of the locations. You have to be careful because some of the dates aren't always correct. And sometimes the spots aren't always correct here either. So scroll and look carefully. You'll find a sign up for option. I'm going to pepper in a little side note here. There was, a couple of weeks ago, a lot of concern expressed by folks who saw that there appeared to be available appointments. We'll say this one, for example. There are 304 available appointments. But then when they would go to sign up for a vaccination, they would get to the end and it would tell them there are no available appointments. And they were like, I don't understand. There's 304. Why can't I get my vaccine? That is something of a limitation of the system. So in order for me to move people from the wait list, which people were using, into the actual clinic, I have to open up appointments to put them into. It's a manual move over. I can't just automatically move somebody from the wait list to it. But that means that while I'm manually calling down the wait list and being like, hey, are you still eligible? Would you like to come in and get a vaccine? There appear to be a whole bunch of appointments available, even though there are actually not. They're kind of held in reserve for the wait list. So just a little trivia piece for why that appeared. And I know it was frustrating. I recognize that technology is not always our friend, but that's hopefully gives a little bit of an explanation for what was going on there and why it appeared that there were available appointments when there were actually not. So we'll say that I'm in Kodiak because it'll be easier than me trying to open up a clinic privately. And you'll get a couple of screens. So the ones with the stars are the important ones. Usually it's first name, race, occupation, date of birth, a way to get a hold of you, a phone number, etc. The health insurance tabs, why don't I just fill this in with my stuff? I don't want to share. We'll say I'll make up I'll make up some fake information here too. So when you get to occupation, parts of this matter, parts of this don't. You can see there's a lot of stuff here. Say I was born in January the 1st of 1918. Sure, why not? It is important that you get your email address correct and your phone number correct, because that is how I get a hold of you if you miss your appointment, or if I need to move you around in a clinic, say a spot opens up. So let's go ahead and do. Cool. So this part has thrown a lot of people for confusion, which is why I wanted to kind of actually go through this step by step, because so many of the questions that I have gotten from folks have been, hey, I'm not sure what I'm doing. Why was this asked? Typically, when you go into a clinic and get a vaccine, there are two costs: the cost of the vaccine going into your arm, and then the cost of the needle and the nurse's time to check you in and actually do the vaccine, and the cost to like store the vaccine, because those are special freezers and fridges and that kind of thing. And so the federal government said the vaccine itself going into your arm is free. The cost of administration may or may not be billed. It's up to the provider. A lot of the clinics, I don't want to speak for all of them because obviously I do not work at every clinic in town, but a lot of the clinics have been waiving the fees and just making it entirely free. So the federal government requires we ask you to have a type of insurance, but then the rest of it, for us at least, has been grayed out because we're not going to charge you anything. Like I said, I'm not speaking for everybody, but at least in my experience, that's kind of how that works. So you don't necessarily have to provide your insurance. If you are interested in the fact sheets, which everybody should look over before you get your vaccine, they are easily found at the FDA's kind of main page. You are welcome to download them. They're each about 5 or 6 pages. Yeah, they look like that. There's nothing usually too surprising on them, but it's still good to kind of be informed. I'm a big advocate for people knowing what they're getting before they get it. So we'll say this is my first vaccination. We'll say I've not previously received a COVID vaccination. We'll say I have heart disease, perhaps. I check yes on this. I've never had any other severe reactions. I'm not feverish nor pregnant. And I go on here to the next page. They give me another chance to look over the fact sheet. I sign my name to say that, yes, I've looked at the fact sheet. Yes, I'm okay with getting a shot. I'm myself. Save and continue. I review my final information. It all looks good. I save and continue. I get to this page, and then I pick a time. Most places will want you to get there a little bit early so that you can actually check in and do your screening. Some places will use like a texting service to where they'll text you when there's an available spot and you can come in. Others will simply say, hey, come in 5 minutes early before your appointment so we can get you screened and get ready to go. So hypothetically, I'm not going to do this last bit, but I'd check whatever time would be good for me. I'd save and continue, and it would give me a congratulations, you've registered screen, and it would send me an email from there. The actual day of the vaccine, I walk into the clinic, I do a little screener if they make sure I'm doing okay at the front door. Like I said, I get here, I tell people to get here usually 5-10 minutes early. There's usually a little bit of variance in how quickly we can see people because it's kind of dependent on how many people are in the clinic. You'll check in, they'll match your name against the list of people on the vaccine itself, kind of getting shots for the day. They'll bring you back, they'll answer your questions. And for me, they would say, hey, I see that you marked yes to your heart conditions. What's going on with that? And they'll tell, I'll be able to talk about maybe a concern that I have, or if I need to do something different because I've got some condition or history or whatnot. Ask your providers what you need, whatever it is that you're curious about. They'll be happy to talk to you about that. For me, for the most part, most of the things that people come in and say, I had this previous thing, or I'm worried about this, usually they are still eligible to get a vaccine. The vaccine that we've been working with, both the Moderna and the Pfizer, are both extremely safe. They are both very effective, and there are very, very few contraindications to actually getting the vaccination. If you tick yes to one of those boxes, everybody, no matter who they are, gets a 15-minute sit after they get their vaccine. People who tick the boxes get a 30-minute sit. That's basically the only difference, and they may provide a little more education, but that's usually what I end up telling folks. So another common question usually is, how do I get dose 2? And do I have dose 2? And is dose 2 even guaranteed? And there's a lot of concern about that. Know that if we give you dose 1, we are basically guaranteeing you that we will give you dose 2. The amount of vaccine that the state reports is what they have. If we get that much, we're kind of being guaranteed by the feds, hey, you'll get another batch of that same amount in a month when you need it for your second doses. So if the state gets 50,000, we actually have 100,000 tapped for the state. We just have 50,000 in the freezers now, and then we'll get 50,000 in 3 weeks. So usually what we do, and this is not, again, I don't want to speak for everyone, but usually what we do at the clinics I've been working at is during that 15-minute sit, while you're already there for observation to make sure you're okay after you get your vaccination, we have you sign up for the second dose. It's pretty hassle-free. Obviously, different locations may do things differently. There was a day when the system went down and we were doing everything on paper. And so I ended up calling a bunch of people the next day and being like, hey, we couldn't sign you up yesterday because our computers had all crashed. Would you like to come in tomorrow? And then we went from there. So things change. If we haven't all noticed, flexibility has definitely been a major byword of the last year. But do know that there are a lot of providers out there who are willing to put in the hours to make sure that you get your second dose if you started that series. So that's kind of the whole thing. Dose 2, of course, you come back on the day, you repeat the same process, you sit for 15 minutes, after you get your shot, and then you're on your merry way. Usually your provider will give you a vaccination card saying, here's your name, here's your date of birth, here's the lot number of the vaccine you got so that you can prove that it was, in fact, the right vaccine. And then there's the date you got it, and usually the signature and location of the person who gave you the shot. So I would sign mine, S. McElwee, Anchorage Health Department. That is kind of the start to finish process for how to get a vaccine. Some common questions that I know people are going to ask, because they ask me this every single time I go into the clinic. Hey, I've heard Pfizer is unsafe, and should I be worried about allergic reactions? Or what about Moderna, or stuff like that? Which is, again, why I absolutely advocate for folks to go ahead and make sure to actually read the fact sheets. They're very informative. So I went and dug up the morbidity and mortality reports from the CDC. They are the most recent reports I could find. This one is from January 15th on Pfizer. I have highlighted the relevant information here. As of January 15th, and obviously these numbers have only gone up, we have given out 1.89 million doses. Of that 1.89 million doses, there were 21 cases of anaphylaxis. Of that 21, 71% of them occurred in the first 15 minutes, which is why we watch everybody for 15 minutes. If something is going to happen, we would like it to happen near trained professionals with epinephrine and medical kits standing by. So I'm not a gambling man, but I would take 1 out of 100,000 odds, which is what you're looking at for Pfizer. Especially when I weigh the known risks and long-term effects of getting COVID. Moderna has something similar, 10 cases of anaphylaxis for 4 million doses. So much lower even still. Either way, like I said, the numbers, to me at least, very safe. I would not be at all concerned. I've gotten both of my doses already. Another thing that commonly comes up, what about, maybe I shouldn't be worried about anaphylaxis, but is there other reactions I should be concerned about? Not concerned, but aware. If you have not had COVID, your first dose will produce probably a little bit of arm soreness. You might have some redness or swelling a little bit at the site. You're getting a needle put into your muscle. It's going to hurt a little bit. For dose 2, or if you have had COVID, your immune system basically runs a fire drill in any vaccination. And for any vaccination whatsoever, no matter what the type is, this is kind of how it works. You get a shot, your immune system goes, oh, I've never seen this before. I wonder what we should do with it. And then the next time, you get a second shot, a booster shot, and it goes, oh, I've seen this before. Let's, call 911. We'll activate the fire alarms. We'll get the firemen to come on out here. Maybe we'll roll the truck over. And everybody goes, oh, good job. False alarm. There's no actual fire here. We can all go home. While that is going on, you will feel sick. Most people get a little bit of a fever. Body aches are common, maybe a headache. You will feel kind of that blah feeling, malaise. All normal, all common, obviously not any fun, but to be expected. That is actually a good thing. We want your immune system to respond strongly, robustly to that vaccine challenge we're giving it. So just know that, especially for dose 2, plan on feeling a little sick the day afterwards. The most common thing I tell folks is it is a self-limiting reaction. Like I said, it's your immune system kind of running a drill. So it should clear up within 24 hours. Drink some water. You can take over-the-counter medication if you need to, but usually it's kind of a pretty quick thing and not too hard to deal with. Like I said, I had it. I get the same reaction every single year whenever I get my flu shot. I got the reaction this time when I got it. I felt a little headachy. I didn't sleep well at night. I woke up in the morning with some body aches. I was good by lunchtime the next day. So obviously, everyone's immune system is different, but plan for that and know that that's a good thing. And that means your immune system is well equipped to handle COVID whenever it actually encounters it in the real world.
Okay. And I'm just going to jump in real quick. And
absolutely.
For those who have... Oh, no, you're good. For those who have joined us since we started, if you didn't hear, if you have a question you would like us to put forward and have answered, please put it in either the chat on Teams or the comments on Facebook. We have someone watching both who will bounce your question to us, and we are happy to answer that. So interject at any time. All right, and did you have another one already planned out to answer?
Yeah, I queued up a couple others. A lot of the questions that I have seen kind of come in some different general themes, so I was trying to address those themes in general. Um, Common one I get asked after I get my vaccine is, hey, can I travel now? Can I throw out all the masking and quarantining and distancing and all that good stuff? And I wish I could say yes, but the answer is unfortunately no. The best analogy, I like analogies that I can come up with, is that vaccination is a lot like wearing a coat in wintertime. You probably could go outside with just a coat, but it'll be a lot better for you if you have a hat and gloves and maybe some warm socks, and you might want like a scarf or something over your face. Like any of those one things by itself is not going to be enough to keep you warm and safe if you're out for a 6-hour hike in the backcountry, right? So the vaccine is very effective, 90, 94%, 95% effectiveness in terms of keeping you from getting really severely sick, which is great. It is not 100% effective. And I at least would hate to be the person who unknowingly introduced COVID to I vaccinated a lot of people and many of them are elders. I would hate to be the person who gave that to them without knowing it and then they go home and get sick. So I know that the answer of we do not have enough data is sort of unsatisfactory. I wish it were not the case. I certainly am very happy. I will be very happy when COVID is over. I have done nothing but COVID for the last year. I'm a little burnt on it myself. But I think it's important to see that we really do have kind of the end in sight here. And it's important to kind of stick with the stuff that we know that is really effective, which has been the mask wearing and the distancing and the keeping circles small, avoiding the crowds and the big gatherings and kind of just going with it. COVID is definitely a marathon, not a sprint. And I think it's important to be able to pace ourselves and pick things that are good for us, but also good for our communities too.
Okay. All right, so let's go ahead and I'm going to jump back to a couple of the questions I have on my list that you haven't covered. You actually managed to get a good number of them through that.
Good.
And one of the concerns I've heard a lot, especially for, and this one actually came from a senior in the community, is if I get this vaccine, am I taking it away from someone who needs it more, even if I'm currently qualified?
No. The way we rolled the tier lists out was specifically done so that people who needed it most got it first, which is why tier 1A tier 1 direct healthcare workers, 1A tier 2 I think it was workers within like long-term care facilities. Once more, an excellent opportunity to pop over and check. If you, let's see, sorry, I look at a lot of pages every day and I can't always keep which ones are which straight. Eligibility details, this is what we want. So 1A tier 1, long-term care facility staff and residents, hospital-based frontline workers. Tier 2, EMS and fire service. Tier 3, workers in general healthcare settings who meet those contact, et cetera, et cetera. So I guess the short answer is don't worry about it. If we've opened up that tier, we're doing so because we feel like we have enough coverage either in the previous tiers to warrant going to the next one, or because we have enough vaccine to cover everybody in that tier and we're just kind of waiting for them to catch up. Which is why 1B tier 1 is probably going to be where we're going to be sitting for a while, and 1B tier 2 is not going to be open for a bit because we're trying to get all of our seniors vaccinated. So yeah, if you're eligible, please sign up. We would love to get you vaccinated. If you're not eligible, know that we will get to you as soon as we can, and we look forward to getting you as a vaccine as soon as we have the capacity to do so.
All right, and that's actually a great lead into one of my other questions is, how will the public be notified when we change tiers?
I'm loath to say check the news, but it's going to be pretty frontline news at any agency. I would recommend, however, that if you are curious and you want the information that covidvax.alaska.gov. Make that put that on your favorites bar. It's useful. They have who is currently eligible and when and where, and they update it very regularly. I suspect that will be the source of any news stories. Is that they have a feed set up and they check it regularly. So keep an eye on the State Department's kind of epidemiology vaccine webpage, and that's probably the best source of kind of firsthand information.
Right, excellent. Okay, let's see. And I was doing some recreational reading to kind of prep for this, and I saw something that says that Alaska is receiving shipments of vaccine on a monthly basis rather than a weekly basis, as a lot of states prefer. Do we know when we're looking to receive our next shipment?
I helped unpack 195 vials of Pfizer yesterday midday-ish. So that's 6-ish doses per vial at 195 vials. You can do some quick math and kind of calculate that out. Those are, I believe, earmarked for our dose 2 clinics. So all the people we've been vaccinating for for the month of January, we got the shipment in. We can start in the month of February. It'll be all the dose 2s for that. There was an email, I guess more correctly, there was a press release that I got an email about 2 hours ago from the state, stating that we had actually officially gotten permission. Let me see if I can find the email. Why not? If you'd like, you can pop onto the press page for the State Department. But the quick stuff here, let's see. For immediate release, a couple of hours ago, Alaska will receive 41,000 first doses of state-allocated COVID-19 vaccine for the month of February. Additionally, 18,500 doses have been allocated to the Federal Indian Health Service. Of course, that's managed by Alaska's Tribal Health System. These two allocations total a lovely 59,600 first doses for the month of February. It does not include the doses sent to the VA or the Department of Defense. And of course, we will get a second batch of that thing of doses shipped to Alaska later this month. So we're not getting them on quite as quick of a basis. It's not a weekly, it's an every couple of weeks, because we'll get dose. We just got that first batch today, and we'll be getting the second doses of that batch shipped later this month. We live in sort of a remote state. That's kind of one of the challenges of living up here. It actually works somewhat to our advantage, because as I was talking about with that bottleneck of it being not enough vaccine and not a bottleneck of not enough providers, which means that when we get a batch of dose at the beginning of the month, we can get through it really quickly, which is why Alaska is currently rocking #1 for most vaccinated.
That's great.
Because we don't have to wait for the 3rd or 4th weeks of January to get our doses for the 3rd and 4th weeks of January. We got them all the first week of January. It made it challenging for us when we were like, oh, we planned for 150 and we got 400. Guess we'll have to do some extra work. But it's really good for the public.
All right, and once again, you've hit on one of my other questions, which is we've heard that some people are getting the vaccine not through the state clinics, but through Native Health Services or through the military. And our question is, what organizations in Anchorage are currently have the ability to distribute the vaccine, and who is eligible to receive from each of those places?
That is a much more involved question than I can go into easily. I will attempt to be succinct. Start with the eligibility on that covidvax.alaska.gov, see if you're eligible, and then pop onto the list of providers and see if they will take you. The short answer is that it depends on each provider, because the state has to follow a specific set of criteria. That's kind of that bit I was talking about with that eligibility as determined by this kind of group of representatives from doctors and medical providers from around the state. The Indian Health Services are not part of that group in the sense that they're not controlled by this. They have their own bucket. They don't have to draw from the state's bucket. Ditto with the VA. They don't have to pull for the state's bucket. They have their own like national level bucket. And so if you're a beneficiary at South Central, go talk to your providers at South Central. They may have access to vaccines that I at the health department don't have because they get a different bucket than me. I wish I could answer that more satisfactorily, but really it's a large and involved question that kind of comes down to there are lots of different pools and people get to pull vaccine from different pools. And that means because they can kind of follow different criteria, some people are vaccinating much more broadly than other folks are because of kind of the restrictions that we have.
So would it be accurate to say if you are eligible to receive services at a specialized clinic such as the Alaska Native Health Center or the VA clinic, check with them to see if they have something available for you?
Absolutely. The more specialized you are, the better your chance of you qualifying for it, because there'll be fewer people competing for that vaccine.
All right. And this one's a funny one because there are two answers to it.
Oh boy.
There's the scientific answer and there's the common sense answer. And that is, how do I tell if I'm getting the real vaccine? We've had a few stories pop up in the news about people who are basically bootlegging fake vaccines. How do we tell if we're getting the right one?
Start by going to a provider rather than somebody's vehicle in the back alley. Maybe less facetiously. I'm going to point you back to the that vaccine eligibility kind of provider map. That's a good spot to start. You know pretty reliably that if you call your case manager, your local provider at the VA, that they are not going to be lying to you. When you go in, you'll be able to, like I said, I always advocate for telling folks, ask your questions. I want to be able to answer those. The vaccine will have a specific look. The person who's giving you the vaccine will write down the lot number on the card that you get, so you can know, oh, it's that batch. They'll write down Pfizer, Echo, Lima, 3249 of the like lot number on this day. Like it'll have a specific thing. And you're welcome to ask the provider, hey, could I look at the vial you just pulled that out of? And they'll probably show you like, it looks like this. I don't think I have any empty vials sitting around on my desk, but you'll see a small glass vial and it'll have kind of the name of the manufacturer on it. It'll have the expiration date on it. It'll have the lot number on it. So there's a lot of ways to check in terms of that. But the kind of common sense answer I think that you were alluding to is go to a reputable actual provider, go to a site that you are either familiar with or that you have gotten, that you've kind of sourced and found through a familiar and reputable site, and you should have no problems there.
All right, and we've got our first viewer question, which is, I am an eligible senior. I'm currently on a waiting list at my doctor's office since the 6th at noon. And my doctor's office is a vaccination clinic where I'm told by my doctor I need to be monitored longer and need to be in his office when I get the vaccine. When will physicians with waiting lists be getting more allocation of vaccines?
Hopefully February, just now, actually. That was that batch of 50-something thousand. Everybody kind of got different allocations, and then it was up to them to determine how they were able to get those out. I used the last of the vaccine in the health department clinic Friday, 5 days ago, whatever that was. So as of now, if you were to walk into the Anchorage Health Department and be like, hey, I'd like a vaccine, I would love to give you one, but I don't have any more in the fridge. So again, it kind of goes back to that. We're sort of waiting on the federal government to ramp up production to where we can actually get it as much as we have capacity for. If you're on a wait list with your provider, stick with it. There's nothing stopping you from signing up for more than one clinic. If you do that, and a lot of people have, please, please go in and cancel your appointments after you get your vaccine. Otherwise, I will call you and be like, hi, you were supposed to be in the clinic. Oh, you got your vaccine last week and didn't? Well, shucks, now I have to scramble and find somebody who is on the wait list and wants to get the vaccination. So my recommendation would definitely be, if you have a provider that you're with, great. Like I said, we just got more vaccine today, so hopefully we'll be able to farm that out as quickly as we can. Obviously, there's administrative requirements there in terms of moving that much vaccine in cold storage, but we'll be getting it out as soon as we can, so hopefully soon.
All right, and she does say thank you for that.
Certainly.
Okay, let's see here. Did that one? Oh, here's a good one. I have had COVID and recovered. Do I still need to get the vaccine?
I would recommend it. I did a lot of research, both in preparation for this and for other stuff. And from what we can tell, when you get the vaccine or when you get the disease, either way, your body develops antibodies, which we want. The vaccine produces kind of a more robust, more long-lasting antibody response. For whatever reason, getting sick with COVID doesn't necessarily, how do I say this? The antibodies can be very strong, and your immune system can respond very strongly to, further infection in the future, which is what you want. But it can also kind of tail off very quickly. There's a lot more variance. That's the word I'm looking for in your immune response after you get sick. So my recommendation to you would be, obviously, don't come in while you're actively sick, because there are other people who are in the waiting room that you would potentially expose. But if you've had COVID, you've got a couple of months of protection. We know that from the research. It's probably somewhere in the area of 3 months or so where you're pretty safe to be around, and you have antibodies, but they do start to wane after that. And I've talked to people who have been infected multiple times, and I've done interviews and contact tracing for them, so I know what happens. So I would say, after you've gotten sick, go ahead, try and make an appointment, go ahead and get a vaccination. The immune response produced from that will last longer than the immune response produced by just getting sick.
Thank you very much. And for those of you who have just joined us, if you have a question you would like to submit, please put it in either the chat in Teams or on the Facebook Live comments, and we are happy to answer those at any time. Let's see. Okay, I'm not sure if we've covered this one yet, but how long before the vaccine starts to become effective? I know it's not an immediate effect.
Quite. It depends. So usually, both vaccines are producing an immune response of over 90%. It's, I think, 94, 95-ish. It takes your immune system usually between like 9 and 14 days for it to produce good antibodies for any vaccination. You go in and get a flu shot, you're looking at 2 weeks. You get your measles shot, pneumonia shot, about 2 weeks. Same kind of thing with this. So depending on which one you get, it's either a 21-day wait for the Pfizer or it's a 4-week, 28 days for the Moderna. So you're looking at either 5 weeks or 6 weeks, kind of from dose to full 90+% protection. Until then, I have sometimes folks will ask me like, hey, I'm traveling out of state. I have to leave for work, or I can't be here for my second dose. Will it expire? How does that work out? Vaccines typically do not expire. If you get dose 1, you don't have to repeat the series and get dosed. Like, you don't have to repeat the series and get dose 1 before you can get dose 2 again. You can just get dose 2. You just won't have full protection until you have the second dose. So full protection works nicely around 90-ish. Dose 1, you're looking at closer to 40 to 60%, and there's a lot more variance because we didn't study people who only got half of a series, in the same way that we don't study people who only put on half of their clothing before going out in the winter.
Okay, thank you. And I'm jumping back up.
All good.
long ways here. Um, we mentioned that there is a helpline going live, either if not already live, very soon. Do we have that phone number so people can have it on their records?
We do. I don't know if I have it saved right in front of me, but I have seen it. I know it exists. And I will do my best to find it if you give me a second.
I'm looking on my side too because I ran across it this morning.
Hmm.
Let's see. Okay. Oh, I think I found it.
If you have the number, say it, and I'll probably remember what it was. It was like a 5566 at the end of it or something. That's not exactly right. But I do remember it's a pair of numbers at the end.
Got it. It's going to be 907 646 3322. And it looks like, oh, this article was just published.
Yeah, we were trialing it today. It's very new. So I did test it before today, and it went to an answering service. So I know it's not staffed 24/7 in that sense, but I believe they have about 40 people who will be helping with it. And I know that there was an email going around the department today asking for volunteers. So it will be staffed. It will probably be staffed during business hours because that's when we can grab people to do it. And if you need a live person, absolutely call that phone number.
All right. And I'm sure that we will put out more information for that as we get it. So that is the end of my COVID vaccine prepared questions. I've got a few things that were just current news for COVID and vaccine that came up as I was doing my research. But before I get into that, I would like to open it up. Do any of our viewers have a question we haven't answered yet that you would like us to go into? We'll give it a minute to see if anyone sends us anything. Okay.
Sure.
One of the wonderful things about virtual meetings, awkward pauses.
My favorite.
All right. So another breaking case that I saw today is that we have our first documented occurrence of one of the more new strains of COVID, which it was the British strain, and it was confirmed in Anchorage during December.
Yes.
Is there any immediate concern that this strain is active in Alaska?
I mean, yes. Not. It's how do I explain this? It's so we sequenced it in December. For the record, Alaska's actually been doing a fair amount of sequencing, comparable to kind of higher. Like Great Britain has been doing a lot of sequencing. England in general has been doing a lot of sequencing. Us compared to the rest of the United States, we're on the upper end of the amount of actual sequencing of infections that we're getting. So there is a good thing there. It is likely that the kind of variant strains of COVID will be in. And if you talk to any epidemiologist or listen to kind of the general chatter amongst them, we expect it and are kind of prepared for it and are anticipating that it will become it'll become the common strain. That the variant strains will become the common ones probably by mid, I don't want to get a specific date, but sometime this spring. Virologists are not concerned by this. New strains come up all the time in disease. It's a slightly more severe. It tends to produce slightly more severe cases of COVID, I want to say, but the vaccine itself should still work fine against it. We're changing one little branch on what is otherwise a very large tree of COVID. It still looks like a spruce tree. the vaccine will still recognize the spruce tree, even if the branches are a little differently configured. The social distancing and masking and all of that proven to work. It'll work just as well against this strain as it did against the variant and the more common stuff. So it's in the state. Yes. Are we concerned about it? Not really. We've kind of been seeing this coming for a little while now, and it's not a cause for concern in that sense.
Okay. You actually answered my second question, which is, what is the recommendation for anyone worried? Which is essentially, keep doing what you're doing.
Pretty much.
Don't do anything you wouldn't already be avoiding. So my next one is, and we're loving this, we're seeing a pretty consistent drop in new cases appearing in Anchorage.
Huh.
And is there anything in particular we think we can attribute that change to, and what should we be doing to make sure that downward trend continues?
A timely question, since I was just thinking of that, kind of to segue from this over. So I don't think anybody is a fan of not going out to eat or avoiding crowded locations or all the other things that were kind of put on pretty strict no-go lists by the most recent emergency order. But the version 3 of EO13 that Mayor Quinn Davidson put out, I want to say rolled into effect 8 a.m. November 9th. That sound about right?
That sounds about right.
Yeah. Given how COVID infection works, we would expect to see about a 10-day lag in results. You get sick, you have to wait 10 days to get out. And so any changes you make, there's always going to be kind of a 10-day, it's going to take 10 days for the cases to catch up with what you've done. So if it came out on the 9th, then we would expect 10 days would be the 19th. I grabbed the kind of 10-day rolling average. I hope you guys can see this. It's a lovely bright shade of red. And let's see, November the 19th, we peak at a miserable high number of cases. That day was a rough day. The 16th, and then the 19th is 366, and then the 20th, the 22nd is 338, and then 227. And it's almost like there's a correlation between nobody going out and being around other people and there being fewer cases, because that's exactly at 10 days. I would love to say that that's not how that works and we can, throw out all of those EOs and never have to worry about doing any of that ever again. But the numbers are pretty telling. So yeah, that's kind of how that works. Keeping our circles small, not necessarily zero, but small. Wearing a mask, even though they're uncomfortable. I share this office space with another coworker, and we both live in our masks, and we both sweat into our masks a lot, and we change those masks, and we hate them when we talk about how much they make our faces itch, but we still wear them because we care about each other. That stuff works, much like hand washing works. It's the really mundane things that actually kind of, when done, it's those mundane, simple things when done by the community as a whole and not just 1 or 2 or 10% of the community that really makes an enormous difference in how any disease actually spreads. Disclaimer, I'm not an epidemiologist, but that is pretty solid epidemiology fact.
Fair enough. I can't say I'm an expert at anything. So we are at our last 5 minutes, so I'm going to give everyone one last chance. If you've got a question, please post it. And we will do our best to answer in the last few minutes. And then last one, and this is probably going to be a pretty quick one that I have, is even though we are seeing definite improvement in conditions, what is the municipality of Anchorage's current evaluation of the risk level for COVID in Anchorage?
We are at high alert. We have been at high alert for many months now. I want to say that anything, the case breakdown is something like more than 10 cases per 100,000 makes us high alert. For the city of Anchorage and the municipality as a whole, if we're estimating generously with, Girdwood and Eagle River and Chugiak and all of those extra places in there, 300 and like 35 cases is what we're looking at, and we haven't hit 35 cases a day in a long time. That being said, I was looking, let's see. Here we go. So our 14-day average is actually 21.59, which still leaves us at high alert, but is pretty doggone good in terms of where we were back in December, for example. I was looking to see if I could find the data for it. I saved it on here. I'm not sure I've got it saved in this. But back in December, the 5th to the 19th, our average case rate was 73 cases. It was a long couple of weeks. I did a lot of contact tracing then. December the 13th to the 26th, we dropped from 73 cases to 46 cases a week, which is still high, but a significant decrease. December 20th to the January 2nd, we went down to 40. January 3rd to January 9th, we down to 39. 10th to the 16th, 31. This last week, 22. You saw that current case number. So we're still high, but compared to where we were a month ago, we've slashed our numbers by a significant percentage. And I'm pretty happy with that as far as things go. Obviously, I'm looking forward to seeing those numbers go all the way back down to 0 because people are unfortunately still dying of COVID every day. But the numbers are looking better, and that's due very significantly because of all of the sacrifices that the actual community of Anchorage is making, and the great people of Alaska are sticking to. Like I said, they're not easy or fun to do a lot of those little things, but that's what really actually matters, is the stuff that everybody has been hammering for months now.
All right. Thank you very much. That's all the time we have for today. Thank you so much for being here today, Samuel, and Absolutely. To everyone. Oh, okay, we're good. Thank you everyone for joining us. We will be doing one more session planned, which will be next week, time to be decided, with public health nurse Amy Dogan. And at that session, we will be discussing, so you've had the vaccine, now what? We look forward to seeing everyone then. As always, I would like to thank everyone for joining us for this program and wish you all a wonderful night. Thank you.
Thanks, everyone.